Hi guys, welcome to channel 365 Days Healthy. Today I will tell you about 8 signs and symptoms that you should never ignore when you have diabetes. The symptoms that we are about to talk about today are extremely important, not to be taken lightly. Before we start, make sure you subscribe. Make sure you like and share this video, and I encourage you to watch until the end, because the last symptom I am about to talk about is the symptom most important evidence. So number 1 is blurry vision. Currently, blurred vision can occur when your blood sugar fluctuates too much, or if your blood sugar drops very quickly from 300 to 400 to 100 within a week or two. Sometimes it's actually a good sign that your numbers are going down, but sometimes it can be a sign of that diabetic retinopathy, and you have to make sure that diabetic retinopathy is taken care of. Squirrels, it's diabetic eye disease. Otherwise they can cause blindness, retinal detachment, cause vitreous bleeding. Therefore, it is extremely important to see a doctor, especially when you have blurred vision. That should not be ignored, because your eyes are very precious and you do not want to lose your eyes just because of a little blurred vision. The second symptom is chest pain. Now, why is chest pain a symptom of diabetes? No, it is not a symptom of diabetes, although sometimes metformin can cause chest pain or some medications can cause chest pain. But when it comes to chest pain, you have to be extremely careful. Don't assume that is reflux, especially if you have high risk factors. What is the highest risk factor? Cardiovascular disease or heart attacks. You guessed it right, diabetes. So when does diabetes happen, especially if you're a man over 40 and you're a woman over 50 with diabetes, and especially if you have risk factors like high blood pressure, high cholesterol, etc. It's basically a ticking time bomb. So basically you need to pay attention to each of your chest pains, especially if the pain is in the middle of your chest. It's like a pressure blocking your breathing, especially if you're moving and the chest pain is getting worse. These are the things you need to be very mindful of. And sign number 3 is disorientation. Disorientation means you basically don't feel like yourself. If you feel like something is wrong, maybe dizzy for example, maybe you have a slur, then you are probably down blood sugar. So check your blood sugar, because low blood sugar can manifest as such without always being accompanied by the shivering, sweating, classic symptoms we've been talking about. So disorientation is one of the common things, especially among the elderly. Now sign number 4 is numbness and tingling in your feet. There was a case where a friend of mine just felt a little numb, a little itchy, and what's next, you guess? He lost a toe and he lost. So if you have numbness or tingling, make sure you pay attention to that. Now, how do you take care of that? You have to make sure you observe, you monitor your own feet. You should check the bottom of your feet, if not daily, at least twice a week, 3 times a week. If you can't get to the bottom of your feet on your own, get someone else to look after you. But it's important to notice if numbness or tingling is the first sign that the skin is not okay. And when problem, normally we feel pretty much anything on our skin, and if you don't feel it, bacteria will get in there. You won't even be able to tell, and that can be detrimental. The number 5 sign is urinary problems. If when you're urinating too often, either you're not urinating at all or you're wetting yourself, these are problems that are generally considered part of diabetic neuropathy. We've got a video about diabetic neuropathy, you can watch it. Bladder problems. 1 is an overactive bladder that makes you urinate too often and you may not even go to the bathroom before urinating. But this also must not be ignored, as it can lead to urinary tract infections, sepsis, etc. It can get really complicated, so make sure you take care of it from the beginning early by getting your blood sugar under control and seeing a urologist. The 6th sign will be abdominal pain. Now, abdominal pain could be pancreatitis, and remember, pancreatitis is common in diabetics. No matter what medication you take, you may or may not take it. What are the symptoms of pancreatitis? Severe abdominal pain right in the middle, just below the breastbone, right in the middle above the stomach. Feels like someone is stabbing you, and it goes all the way to your back, and it's also associated with nausea and vomiting again. Certain medications that slightly increase the risk of pancreatitis, such as Ribelsis, Ozempic, Trulicity, and Bydureon. So you have to be careful about the signs of pancreatitis, and again, you don't need to take medicine if you have diabetes. You can get pancreatitis at any time. Now, number 7 is the smell of food or the smell of your breath, which is more important for type 1 diabetics, but it happens to type 2 diabetics as well, especially if you are using an SGLT2 inhibitor. These are Jardiance, Farxiga, Invokana, 𝗬𝗬, these are the drugs that actually increase the risk of diabetic ketoacidosis. In addition, if you lack insulin, you can increase your chances of developing diabetic ketoacidosis, which can be fatal. So if your blood sugar is high, and you have this footy smell, have a stomach ache, you have breathing problems, you're breathing heavily. Don't wait, you need to go to the emergency room. And the last sign, symptom, or eighth sign that you shouldn't ignore is leg pain. Now, who hasn't had foot pain in their life? Everyone has foot pain. Most of the time it is ignored. People say it's my knee, or what could it be? I've been walking for so long, anything. But remember, diabetes carries a very high risk of peripheral artery disease. What does that mean? The arteries in your legs can become blocked, and it's extremely common, especially as you get older. And now what happens when you ignore that? Well, if you have pain on the bottom of your foot or anywhere in your leg, it won't heal. How can you heal a wound if you don't have nutrients and oxygen delivered to the dead area? So that's why people lose their toes, they lose their feet, sometimes even below the knee. Let the doctors decide to check your pulse. There are certain tests called ankle brachial index, duplex study, etc., which your doctor can perform to identify blockages in your arteries.